Hey everyone, Dr. Mike here. Today, we're diving into a fascinating topic that affects each and every one of us every single day. Let's talk about something amazing, our lungs. These incredible organs are responsible for keeping us alive by providing our bodies with the oxygen we need. Have you ever wondered how we breathe? It's a process we often take for granted, but it's truly a marvel of biology. It all starts with the incredible elasticity of our lungs. This elasticity allows our lungs to expand and contract with each breath we take. Think of a rubber band. When you stretch it, it extends, and when you let go, it returns to its original shape. Our lungs work in a similar way. They can stretch to take in air and then bounce back to push the air out. This ability to expand and contract is thanks to their elastic nature, which is essential for efficient breathing. Lung elasticity refers to the lung's ability to stretch and recoil. This property is what allows us to take deep breaths and exhale fully. This property is crucial for breathing. Without it, our lungs wouldn't be able to inflate properly when we inhale or deflate when we exhale. Imagine trying to blow up a balloon that doesn't stretch. It would be nearly impossible. Similarly, without elasticity, our lungs wouldn't function properly. The elasticity of our lungs is maintained by the proteins elastin and collagen, which are found in the lung tissue. These proteins give the lungs their stretchy, resilient properties, allowing them to handle the constant cycle of inhalation and exhalation. Over time, factors like aging, smoking, and certain diseases can affect lung elasticity, making it harder to breathe. That's why it's important to take care of our lungs by avoiding harmful habits and staying active to keep them healthy. So, next time you take a deep breath, remember the amazing stretchiness of your lungs and how they work tirelessly to keep you breathing. Appreciate the incredible design of your body and take steps to maintain your lung health. Thanks for watching, and take care. Now, let's talk about elastic recoil. This is the force that makes the lungs spring back to their resting state after being stretched during inhalation. Imagine stretching that rubber band again. When you let go, it snaps back due to its elasticity. The lungs are primarily composed of tiny air sacs called alveoli. These alveoli are coated with a thin layer of fluid that creates surface tension. This surface tension contributes significantly to the elastic recoil of the lungs. But wait, there's more to the story. The lungs are surrounded by a double-layered membrane called the pleura. The space between these layers is filled with a small amount of fluid, creating a negative pressure environment known as pleural pressure. Pleural pressure plays a crucial role in keeping the lungs inflated. Think of it like this: the negative pressure acts like a suction cup, holding the lungs open. This constant negative pressure ensures that the lungs don't collapse. Now let's talk about alveolar pressure. This is the pressure inside the alveoli, those tiny air sacs where gas exchange occurs. When we inhale, the diaphragm contracts, and the chest cavity expands, lowering the alveolar pressure. This decrease in alveolar pressure creates a pressure gradient between the atmosphere and the alveoli, causing air to rush into the lungs. During exhalation, the opposite happens. The diaphragm relaxes, the chest cavity shrinks, and alveolar pressure increases, forcing air out. Section 5. Why understanding lung pressures matters. Understanding lung elasticity and pressures is crucial for comprehending how we breathe. These concepts help explain why we can take deep breaths, why our lungs don't collapse, and how air moves in and out of our bodies. Moreover, it helps us understand various respiratory conditions. For example, diseases like emphysema can damage the elastic fibers in the lungs, making breathing difficult. Section 6. Elastic recoil and lung diseases. What happens when things go wrong? In this section, we will delve into the critical role of elastic recoil in lung function and explore what happens when this process is disrupted by various lung diseases. As we've learned, elastic recoil is vital for proper lung function. It allows the lungs to return to their original shape after inhalation, ensuring efficient air exchange. However, certain diseases can disrupt this delicate balance. When the elastic recoil is compromised, it can lead to significant respiratory issues. For instance, in emphysema, the walls of the alveoli are damaged, reducing their elasticity. This damage is often caused by long-term exposure to irritants like cigarette smoke. This loss of elasticity makes it harder for the lungs to recoil during exhalation, leading to air trapping and shortness of breath. Patients with emphysema often experience difficulty in breathing, chronic cough, and fatigue. Air trapping occurs because the damaged alveoli cannot expel air efficiently, causing it to remain in the lungs and making it difficult for fresh air to enter. Understanding how elastic recoil is affected in different diseases helps healthcare professionals diagnose and treat respiratory conditions effectively. By recognizing the signs and symptoms of impaired elastic recoil, doctors can develop targeted treatment plans. Treatments may include medications, pulmonary rehabilitation exercises, and lifestyle changes to manage symptoms and improve quality of life. Advances in medical treatments and innovations in respiratory care continue to provide hope for patients suffering from lung diseases. Early detection and intervention are key to managing these conditions effectively. With proper care and management, many patients can lead fulfilling lives despite their respiratory challenges. The journey may be difficult, but understanding the importance of elastic recoil and its impact on lung health is a crucial step in the right direction. Section 7. The importance of lung compliance. Closely related to elastic recoil is lung compliance, which refers to the ease with which the lungs can expand. Think of it as the opposite of stiffness. High compliance means the lungs can inflate easily, while low compliance indicates they are stiff and require more effort to expand. Lung compliance is essential for efficient breathing. Factors like lung tissue elasticity, surface tension within the alveoli, and chest wall flexibility all contribute to lung compliance. Section 8. Factors affecting lung elasticity and compliance. Several factors can influence lung elasticity and compliance. Age is a significant factor, as lung tissue naturally loses some elasticity as we get older. Smoking is another culprit, as it damages the elastic fibers in the lungs, reducing both elasticity and compliance. Other factors that can affect lung function include obesity, respiratory infections, and exposure to environmental pollutants. Maintaining healthy habits and avoiding harmful substances can help preserve lung elasticity and compliance throughout life. Section 9. Measuring lung function, spirometry, and its significance. Doctors use a test called spirometry to measure lung function, including lung capacity and airflow. This simple, non-invasive test helps assess how well your lungs are working and can detect early signs of respiratory problems. During spirometry, you breathe into a mouthpiece connected to a machine called a spirometer. The spirometer measures the volume and speed of air you inhale and exhale, providing valuable information about your lung health. Section 10. Keeping your lungs healthy. Tips for optimal respiratory health. Our lungs are vital organs that play a crucial role in our overall well-being. They are responsible for supplying oxygen to our bloodstream and expelling carbon dioxide from our body. Therefore, it is essential to take proactive steps to ensure their health and functionality. Just like any other part of our body, our lungs need care too. Neglecting lung health can lead to various respiratory issues, which can significantly impact our quality of life. Fortunately, there are several simple, yet effective ways to keep our lungs in top shape. Here are some simple tips to keep your lungs healthy. These tips are easy to incorporate into your daily routine and can make a significant difference in your respiratory health over time. Don't smoke. Smoking is the leading cause of lung disease. It damages the airways and the small air sacs in the lungs, leading to conditions such as chronic obstructive pulmonary disease, COPD, and lung cancer. Even occasional smoking can be harmful, so it's best to avoid it altogether. Quitting smoking is the single best thing you can do for your lung health. The benefits of quitting start almost immediately, with improved lung function and reduced risk of lung disease. There are many resources available to help you quit, including support groups, counseling, and medications. Avoid secondhand smoke. Secondhand smoke is also harmful to your lungs. It contains many of the same toxic chemicals that smokers inhale, and prolonged exposure can lead to respiratory problems and increase the risk of lung cancer. Make sure your home and workplace are smoke-free environments. Exercise regularly. Regular physical activity strengthens your lungs and improves overall respiratory health. Activities such as walking, jogging, swimming, and cycling can enhance lung capacity and efficiency. Aim for at least 30 minutes of moderate exercise most days of the week. Protect yourself from air pollution. Limit your exposure to air pollution by staying indoors on high pollution days and wearing a mask when necessary. Air pollution can irritate the airways and exacerbate respiratory conditions. Use air purifiers at home and avoid outdoor activities during peak pollution hours. Get vaccinated. Get vaccinated against respiratory infections like the flu and pneumonia. These infections can be particularly dangerous for individuals with compromised lung function. Vaccinations help protect you from severe illness and complications, ensuring your lungs stay healthy. By incorporating these healthy habits into your routine, you can help maintain optimal lung function for years to come. Remember, your lungs are essential for your overall health, and taking care of them should be a priority. Stay proactive, make informed choices, and breathe easy knowing you're doing your best to support your respiratory health. Section 11. Conclusion: breathing easy with knowledge. Understanding how our lungs work, especially the concepts of lung elasticity, pleural pressure, and alveolar pressure, empowers us to take better care of our respiratory health. By being aware of the factors that can affect lung function and adopting healthy habits, we can breathe easier and live healthier lives. Remember, knowledge is power when it comes to our health.